Good afternoon, everyone. If we could go ahead and find our seats, we'll go ahead and get started. We have a busy day, busy afternoon set up, so we want to make sure we're making the most of our time together. We'll get started here in just a couple of minutes.
Good afternoon, everyone. All right, so this is our return to in-person event, so I need a little more energy than that. Good afternoon, everyone. You can't replicate that over a Zoom call, I will say that. I want to thank everyone for being here. I'm Zach Schamberg. I'm the president and CEO of the Pennsylvania Healthcare Association, or PHCA. I want to thank those of you who are joining us in the room today in person. I also want to thank those of you who are joining us via live stream on YouTube and on PHCA's social media channels. So why are we here today? We are here today to attempt to solve what we believe is the greatest issue and challenge affecting long-term care in Pennsylvania, and that's our workforce. Specifically, it's recruiting and retaining a skilled workforce for our nursing homes, our personal care homes, and our assisted living communities. And we're seeing that issue and that challenge play out already throughout the state. Hospitals are having difficulty discharging their residents, and we have long-term care providers in PHCA's membership who have quite literally had to turn away vulnerable senior citizens in need of care simply because they didn't have enough staff to care for them. And if that's something that doesn't alarm every single Pennsylvanian, it should. Not just for what it means today, but what it could mean in the next few months and few years. Numbers and the statistics paint a very bleak picture. Nursing home employment is at its lowest point in terms of employees nationwide since January 2007. Since the beginning of the COVID-19 pandemic and early 2020, nationwide nursing homes are down nearly 250,000 employees. And in Pennsylvania alone, since January 2018, we're down approximately 20,000 employees. The turnover rate for nurses right now is nearing 50%. And there's a reliance more and more on agency staffing rather than full-time employees. The demographics of Pennsylvania paint a different picture. We are one of the oldest states in terms of population in the entire country. Our fastest growing demographic is age 85 and older. And we're approximately 3 years away from what's called the silver tsunami, or the time when the baby boomers will age into the demographic most in need of long-term care. So have I scared you yet appropriately? And I don't mean to do that, but that's why we're here today. Now, we've discussed this issue internally at PHCA, and I give a lot of credit to the PHCA staff for tackling this issue. We've worked with our members on this issue. We've worked with our statewide workforce committee, but we need your help. And we've assembled this group today: regulators, policymakers, lawmakers, educators, stakeholders, and I don't mean for all those words to rhyme, by the way, and providers, to think outside the box on how we solve the workforce crisis in long-term care. So in a few moments, you're going to hear from our first panel, and we're going to talk about how we got here. Then you're going to hear from our second panel, and we're going to talk about innovative solutions that are being implemented not just here in Pennsylvania, but throughout the country. Then we'll go to our third part of today's session or proceedings, where we're really going to get into the weeds. And you're going to collaborate with folks at your table to talk about big ideas, obstacles to those ideas, and then solutions to those obstacles. So I hope you're really excited about what we're going to do today. We're going to take all of your ideas, we're going to put them up on the PHCA Big Idea Board, which I'm going to ask for some help to carry home after this, if anybody would like to help me with that. And we're going to really then get to work, an internal group, to get some of these ideas implemented and done. Now, before we start with our first panel, we would not be here today without the generous support from our sponsors. And I really want to thank all of our sponsors today. You're going to hear from our sponsors a little bit later today. First, I want to thank PA Health and Wellness for the snacks, afternoon snacks, and the afternoon coffee. As a father of 2 young girls who have just given up on sleeping, I will be at that coffee station later, so thank you. I also want to bring up our sponsor for round one, and that's Kara Greenwell of ShiftMed. Kara, thank you.
Good afternoon. I'm Kara Greenwell from ShiftMed. With 60,000 healthcare professionals nationwide and growing, ShiftMed instantly connects nurses and healthcare professionals to healthcare providers with needs. Healthcare shortages across Pennsylvania are no surprise. No sector has been hit harder than long-term care. We're proud to partner with PHCA for this afternoon's round one discussion, How Did We Get Here? In this 30-minute round, we'll get insight into the systematic workforce challenges that exist within long-term care and senior living sectors. from providers that live it every day. Zach, I'll turn it over to you and our round one panelists.
Thanks, Kara. Thanks again, ShiftMed, for sponsoring round one. So let's get right into this, and we're going to open this up with our first panel. I'm joined by Eugene D. Pasquale, Steve Tack, and Meredith Mills, and then we're going to open it up to Dana and Jeffrey in round two. But Eugene, I'm going to start with you. Former state representative, former auditor general, former congressional candidate. So I don't know what title I should use for you today. But
Just Eugene.
Just Eugene. It's funny, and folks in the audience may be asking, why is Eugene D. Pasquale on our first panel with two providers? But here's the answer. During your term as Auditor General, you were tasked with auditing the Department of Health. And through your audit and through your research, you really honed in, and I think you were the first statewide official to really spotlight the workforce crisis in long-term care. And in fact, your report was called Who Will Care for Mom and Dad? Talk to us about that audit, what that yielded, and what you found.
So from 40,000 feet, we knew that workforce was a problem in Pennsylvania. And the question was, and there was a little bit of a dabbling of this, and maybe to the Rendell administration staff, they'd say they more than dabbled in it, was identifying future employment clusters. And so I knew that existed, but I wasn't convinced that much had been done to actually address those future clusters, which the healthcare industry, nursing, et cetera, was one of those clusters. But Rendell had left office in 2010, January 2011. And so when we started the audit, you're talking about 2017, 2018, it had been at least 7 years removed from when those clusters were identified. And as someone who had, when I started this audit, we had been in every state agency. And one of the things that was a concern was you had all these different silos when it came to workforce development. You had unemployment issues, workforce training, but even in the workforce training, you had something at Labor and Industry, you'd have something at Department of Community and Economic Development. And in the academic world, meaning community colleges, et cetera, very little cohesion on some of these programs. And again, we're a very big state, and you combine that with where the state was heading demographically. This is well before COVID. And the audit showed what can be best described as the state was acting exactly in the silos that you would have been concerned they were, which was no coordination. And what really started the audit was that one thing we kept saying, you look at this data, and every time that Pennsylvania Chamber of Business and Industry would do an annual survey of their actual members. And I'm not talking about what gets the most sound bites and somebody complaining about, taxes or regulation. I'm not saying that those aren't issues, but the actual members of the Pennsylvania Chamber every year for around 4 or 5 consecutive years, and Gene Barr would verify this, and I know Gene's retiring soon, say is workforce development and training was their number one issue across the board. Again, I want to be clear. It doesn't mean nobody complained about taxes or regulation, but this was clear in a way to where, and it kept growing. You have that combined with the demographic challenge the state had, then all of a sudden you have a potential nightmare. And then our audit verified the nightmare, which was not only was there no cohesive plan to address it, there was no plan at all. Now, to the Wolf administration's credit, a lot of times when you get one of these audits, you just have this press volley back and forth as to the Auditor General is, out of his mind, or it's not really that, or we're doing all these other things to address it. That didn't happen. They agreed with the audit's findings, and the governor signed an executive order forcing a task force of all these various entities to come together to address this. And the task force did begin to meet. And then COVID hit. And I don't know if then I leave office. To the best of my knowledge, it kind of stopped dead in its tracks. And so where we are today was, there was at least acknowledgement the problem existed, but all these different state agencies exist in these silos. There is no cohesive plan, a demographic, train wreck that's coming. And the biggest problem, and again, it's not that anyone, I want to be clear, everyone is sort of doing their individual job, but addressing workforce development in long-term care isn't great soundbite. Recruiting a solar energy company, that's a great ribbon cutting. It's important too, but it's a great ribbon cutting. Opening up a manufacturing plant, bringing a new, big warehouse that's adding 10,000 jobs across the state. Like that's all. This is not one that it's sort of like the movie The Blob. It slowly creeps on you until it's too late. And I think we're getting dangerously close to that. So again, to come back to our audit found, there's all these workforce development programs. Not one of them was coordinated with any state agency. If you were in Department of Community and Economic Development, you weren't coordinated. And there was an effort to address this, but my understanding is COVID stopped that dead in its tracks.
So, and I want to get the provider perspective on that. And Steve Tack, I want to start with you. And for those who don't know, Steve, you're the CEO of Quality Life Services. You're based in Butler, Pennsylvania. You have nursing homes, you have personal care, you have assisted living. And Quality Life Services is a third generation company at this point as it relates to long-term care. So I want to tackle this from the nursing home side. Where did this go wrong, and how did this issue get to the point where we're having a summit on workforce challenges today?
Well, interesting. Thank you, Zach. But it's interesting in thinking about kind of how we got here. Kind of went, and here we are, February 23rd, 2022. Went back 2 years to February of 2020. And I think about what did we spend our greatest effort of focus and concentration? It was recruitment, retention, and decreasing outside agency usage and controlling costs, because at that point we'd went 6 years without a rate increase. So now here we are. Then was it the end of February 2020 is when the nursing facility in Kirkland, Washington had its outbreak, and we all know what we've dealt with for the last 2 years. Now I look back and think, gee, we wish we had the problems of 2 years ago. Because what's happened in the 2 years is we went 2 additional years without a rate increase. We're spending 38 to 40% more on staff recruitment than we did 2 years ago. Our cost per hour for our own staff has went up 30%, and our cost for outside agency has went up 362%. All the time, like I said, again, of 2 more years without funding increases. So we're spending, that is our focus. How do we try to find and retain additional employees? And part of the problem is, although Pennsylvania's unemployment rate is going down, the number of people in the workforce is also going down. So the problem actually is not just for long-term care, although we certainly are all here to try to fix that. We could be up here for all day telling stories about the incredible work our staff have done over these last 2 years. And just before I drove out here today, had a chance to celebrate 30-year anniversary of 2 longtime employees at one of our centers. And can't say enough about them, but somehow we have to get more people back into the workforce. Our workforce participation is lower than I think it's just about ever been. The average age of an RN in the country is over 50, I think 52. So we have to either figure out how to get the people who have left the workforce into it, or figure out how to bring more people into the workforce.
And I think, Meredith, that's a good segue to go to you. And Meredith Mills, President and COO of Country Meadows Retirement Communities, also a multi-generational family-owned business, nursing homes, personal care and assisted living, with really the focus on personal care and assisted living. And I want you to take this from that ALPC perspective And in your mind, as you've watched this unfold, how did we get here on the ALPC side, and what do you think can be done?
Well, I think to Steve's point, we were all so hyper-focused on these areas already, going into the pandemic, and we were proud that our retention numbers were spectacular compared to the rest of the industry. We were looking at about a 35% turnover rate going into the pandemic in terms of our coworker retention. But not being able to bring people on site to our facilities, not being able to have them interview in person and see that this is a home-like setting that feels like a nice hotel, not a hospital. Adding the masks and the PPE and all of the restrictions that take away from the closeness and the hugs and the time with our residents that really are a part of the rewarding experience to be a caregiver and not just to be working at a fast food chain, serving a customer. You really are gaining an experience and a relationship through the work that you do in our industry. We lost a lot during COVID in terms of that closeness, in terms of a lot of the social support networks that our caregivers depend on. I've been with my company 10 years, but 5 years ago, I was leading one of our campuses, and I'm about in the age range that many of our caregivers are, females, childbearing age, and we can't get childcare that's affordable, that extends to a time period where we can support our 24/7 staff. And the housing markets have exploded, and a lot of our caregivers can't afford to live within commutable range of our facilities. So there's so many other dynamics that I think are affecting every industry right now that are affecting our specific demographic of caregivers. But I think that one of the things that everyone forgets in this whole mix is, the hospitals are really struggling, yes, and we recognize, and I think we all feel for the fact that they're still caring for unvaccinated patients, whereas we at least have the benefit that close to probably 100% of our patients, residents are vaccinated, and the majority of our staff, in some cases all of our staff are. But what the hospitals are now starting to see is how we are such a vital piece of the healthcare continuum. And even in assisted living in Pennsylvania, we can do almost as much as a skilled nursing facility. And we bridge that gap between home health or living at home with an aide and needing to be in a skilled facility or needing to be in the hospital and caring for people with multiple chronic conditions who are going to burden our healthcare system. And I think COVID has brought out so many of these realities and weaknesses of our overall support system for all adults in Pennsylvania. So we had started to look prior to the pandemic at different immigrant groups that are already here. Lancaster is a very vital immigration welcome community, and had started to work with some key demographics there. A lot of our folks from South America are really natural caregivers and really honor their older loved ones. And we just need to be able to provide them with classes and certifications and an ability to use their licensure. Doctors and nurses who are foreign are not able to use their licensure here, but yet they're wanting to work, they're wanting to contribute, they're wanting to learn our culture. And those are some groups that we had started to tap into prior to the pandemic that I see a lot of opportunity with.
Thanks, Meredith. And Eugene, I want to go back to you. So again, digging into the audit and digging into your analysis on the long-term care workforce.
By the way, I want to point out there was two separate audits that one was of the Department of Health specifically on long-term care, and the other was an audit of workforce development programs. So I might have been in my own mind blending those two, but everyone should know there were two separate audits.
And in that workforce development audit, Meredith, we heard talk about lots of opportunities like immigration. Did that audit, other than having or forcing state departments to work with one another, were there other results that came out of that audit that you thought, this can be implemented, this can be done in Pennsylvania, and this could really help us moving forward?
The biggest area we saw that wasn't being done when we did the audit was there wasn't a future prospective as to where are things going. So all of these programs were running as at where are we right now? Or where do we wish we were? Because some parts of the state have moved beyond, the mills aren't coming back type of thing, but not every part of the state has done that. For example, I think, and again, with God, I know it was a hard way to make a living, and I feel bad for people that lost their way of life in this. But there was 3 million put into specifically coal mining, and those jobs aren't coming back. I mean, it's where the train is heading on that. And that's just one example of not looking at where this thing is going. And really the future of Pennsylvania employment-wise, and it's not just in long-term care, but the healthcare industry itself is where the lion's share of the job growth, along with academia and tourism. I mean, those are the three, COVID aside, and obviously it had a significant impact, probably if anything, bumped up the healthcare numbers. But those were the three areas that when we talked to business groups outside of the audit, that was undeniable about where the job growth was, but the state programs weren't being administered reflecting that.
Got it. And talking about now the last 2 years, Steve, so you brought up that everything has changed, and I think we can all acknowledge that everything has changed, especially as it relates to long-term care, since March 2020, when the COVID-19 pandemic really hit here in Pennsylvania. You and I have talked about the changing feelings or expectations of our workforce and trying to meet those demands. Something as simple as the old 8-hour shifts just don't fit anymore for the younger Pennsylvanians who we want to recruit to this industry. Can you talk a little bit about that?
Well, we've talked a lot about scheduling and how do we adapt to what the workforce wants and needs, and the changing. I'm a Gen Xer. I think everybody, like every generation, we think everyone thinks the way we do, and as my kids now get older, I realize, no, the next generation does think differently, and that's okay. I thought differently than my parents. But our expectation of work, what we want out of what generations want out of work, the number of days they want to work, the number of hours they want to work per day. But yet, for instance, our regulations still, we have to fill out things that say how many people we had on daylight, afternoon, at midnight shift, which are based on 19th century manufacturing. And we're in the 21st century of healthcare. I get frustrated by some of that sort of thing. And we just have to be able to adapt and change. And we need our regulations and our regulators and those sort of, we have to change those thought processes.
And when it comes to funding, because funding is so important, and I'll position this question both for you, Meredith, and Steve, private pay limitations, Medicaid limitations. What does that mean for this workforce? And I think that's really contributed as well to how we got here and the shortage that we face.
I feel in awe of how our skilled nursing facilities that are 70% Medicaid are still functioning. McDonald's can raise their rates 13% for customers and can raise their pay rates 8% and make earnings that are unheard of this year. And yet we can't keep up in competing with those same jobs because we have a cap that hasn't been raised in 7 years. And I'm in some ways lucky that the majority of our customers are private pay, but at the same time, they're on a fixed income. And there's only so much that we can raise their rates, and we have one product to raise the rate on, their monthly rent. And I think a lot of people assume that because our industry is so hard hit during the pandemic that we got so much funding from the government. And unfortunately, we weren't eligible for a lot of it because we were too big with 2,500 coworkers. So there were a lot of challenges that we had to just eat the cost on, and we did it because it was the right thing to do. But then when you continually get hit with vaccine mandates and staffing ratios that are just continuing to raise the bar, you start to focus on that rather than, some of the other things that you should be focusing on with retention and recruitment of staffing. But, I think it's very difficult for us sometimes to compete with other industries because of our funding limitations. And that will continue to be something that we invest in and eat the margin in because it's the right thing to do.
I'd echo that. Our organization's 75% Medicaid, so those rates haven't changed in 8 years. And, but we've given pay raises, cost of living increases every year, I think, but one. And that was very painful to not be able to do that one year. But, the margins are gone. They kept eating into them until there is no margin left. So it is a real challenge when you're still getting just $200 a day to care for somebody round the clock and provide all those services for them.
So on that note, I want to wrap round one, and that's how we got here. That's laying the foundation for the workforce crisis as it exists today. I want to go to round two, and we're going to bring in both Dana and Jeffrey, and we're going to really involve the whole panel, but Dana and Jeffrey will focus on you first. I do want to thank also our round two sponsor, IntelliCare. And unfortunately, IntelliCare couldn't be with us today, but we do really want to thank them for their support of this event and, again, the workforce crisis that we're combating today. So, Dana, I'm going to start with you. You are the senior director or a senior director at the American Healthcare Association. And for those who don't know, the American Healthcare Association, or AHCA, is really the parent association of the Pennsylvania Healthcare Association. They're based in Washington, D.C., and it's their job to follow not just what's going on in the Capitol, but what's happening throughout the country. And Dana, your focus is on workforce, which obviously is the topic of the hour, not just here, but in Washington, D.C. What I really want to know is success stories. What can you tell us? What is being done in D.C., or what is being done in 2 or 3 states throughout the country that you believe Pennsylvania should be mimicking and implementing right now?
Great question, Zach. And I'll just say the association, all hands are on deck with this issue. It's by far the biggest issue, the workforce crisis that we're hearing from providers. These 2 providers up here that shared their stories, we're hearing it every minute, pretty much. I mean, similar stories. It is, again, the biggest issue right now. Our states are really trying to think creatively, and we're also really trying to support them at the national level where we can on policies that'll hopefully trickle down and impact them at the state level. Some of the unique ideas that I've personally heard are from some of the other state execs as well, like Zach. And one of them in particular out of Wisconsin, they have a program set up there with the University of Wisconsin where they're offering a $500 credit tuition reimbursement essentially for any of the students there that are interested in going into the healthcare field, in particular nursing home, assisted living, developmental disability related homes. Working in there for basically that semester, they get a $500 credit towards their tuition. And with the hope, obviously, that they'll stay in that field, make it a long-term care, pathway for themselves. So that's something that's definitely been unique. We have a number of our states as well that are doing quite a bit of like public affairs marketing, really encouraging individuals to get into the direct care field. They're receiving grants on the state level. That's been something that's certainly been helpful. In Florida, over half of the nursing homes there have basically a program set up where, again, it's really encouraging individuals to come in, help train them, keep them in the field, to hopefully help grow the workforce. Tuition reimbursement, that's been a big effort as well too. But again, just kind of trying to think creatively. We have, you mentioned as well on the refugee side, immigration side or immigrant side, there's 2 states in particular that we're working with right now. There's been thousands and thousands of refugees from Afghanistan that have come over recently with the crisis there. We've really tried to partner not only with the Afghan refugees, but others as well, obviously, that are interested in this field. In California, we have a pilot that's going to be getting underway there with some of the Afghan refugees. Some of our centers, our provider members are going to help train them in, and again, with the hope that they stay in the field and can grow from there. So again, kind of just trying to think creatively, outside of the box right now. Zach went over the workforce numbers right now. It's just staggering. The long-term care industry has been hit hard. Some of these other industries have really rebounded. We are still very much in pandemic mode right now. So, it is all about creative thinking. I love the fact that we're doing this discussion right now, and we're going to bring that back to the national level to share with other states as well, because we need to be doing this all across the country.
Thanks, Dana. I want to come back and talk about some of the things that DC has implemented, like temporary nurse aid program, which I know has been a lifeline to our providers. Jeffrey, I want to go to you now. Senior Vice President, Workforce Development at Dignity Health. You spent 9 years in hospital administration. You were in leadership roles at Lebanon Valley College and Harrisburg University. So you've seen this issue, but from other lenses, from other industry perspectives. Looking at Pennsylvania, what do you think can be done in long-term care that maybe other industries or sectors have had great success with?
Sure. Well, I think to Eugene's exact point, we've got to fix the silos. So at a state government level, you can't have a situation where you have funding in L&I and you have funding in education, you have funding in Department of Health, yet we're not doing anything together. So that's the first thing we've got to do. And you know, frankly, I think it's way past time that we've had governor after governor after governor, and we still have the same exact problem because the crisis has been here for a long time. So Democrat or Republican, they've all failed on this very issue. We've got to fix it. The colleges at all levels have actually been at the table. Community colleges in this region, Harrisburg Area Community College, and many others have worked to solve this. They've got programs. The challenge is we don't have adequate funding to get the students. So, you know, there's a couple of things I think we've got to do. What Dana's talking about is pathways and pipelines. We've got to create a model in the K through 12 space that actually makes a younger individual want to serve. This is ministry. This is serving. We've got to get them into those facilities. And we've heard about the challenges during COVID. So, you know, my hospital days, we would bring the youth in at very early ages and have them sit through a cardiothoracic surgery so that they could become the next Dr. Zama. And I'm not saying that because he's running, but he was our surgeon at the time. So they would see the benefit of those experiences. We've got to do that. I often tell people when I was a Boy Scout, I went into a long-term care facility. Still remember it in the Poconos today, Brookmont. It was an interesting experience. For me, it taught me Jeffrey's not going clinical, but it did teach me about the benefit that I knew as a son of a nurse that my mother was serving in those types of facilities. So that's the moral of the story is we've got to create these models where we're getting the youth into these facilities. We've got to reward them. So, you know, I've shared with Zach that I serve on the IU Board 13. We've got funding at IU boards. We've got funding at workforce boards, but we're not unifying. So if the crisis is long-term care, which we've talked about here, why are we not unifying that funding and going at K through 12 to create the future pathways? That's what we've got to do, and we've got to do it quickly.
And Jeffrey, I'll stay with you. You've talked about, so you're talking about now the ecosystem of government, but talk about the ecosystem of long-term care. And this is something we've focused on a lot. I know it's something we've talked about as providers as well, knowing that long-term care, I think Meredith, as you said, plays such an integral role with every other part of the healthcare continuum.
Yeah, so, you know, I view it as the continuum of care. You know, the reality of it is even in my hospital days, the work that we did as a hospital was pre-hospital to acute to post-acute. And one of the things that I enjoyed the most of being in a community hospital setting is that we actually cared about those relationships. We've got to get all of acute care at all levels to see that this is pre-hospital to acute to post-acute. And sometimes it's reversed, post-acute back to acute and back to pre-hospital and all the way through the continuum. We've got to view this. And so Zach and I always talk about this at all levels of associations, even at the hospital association. They have to view this as a crisis that impacts them. So instead of viewing it now that we can't send our patients to long-term care, we've got to view this as we share workforce, because the reality is we do share workforce. There are people that serve in both. So again, we've got to create that model of that ecosystem that we know colleges at all levels, community college, four-year privates, four-year publics have nursing programs, they have this program. But what are we doing to create this ecosystem where they understand, well, I'm going to go and serve in post-acute, and then I'm going to come back and serve in acute. My own mother served in both. And you know what she always said to me? For her, it was serving to help another patient. She saw benefits in both. I think our Commonwealth across the board, not unlike other states, have been too focused on the acute care space. And we've got to create this continuum model where we focus on each equally.
Thanks, Jeffrey. And I want to come back to education because I think this does play a really important role in talking about a long-term care career in the K through 12 years or during the K through 12 years. But Dana, in Washington, D.C., at the beginning of the pandemic, there was a really innovative program, the temporary nurse aid program, that I know many providers in the room, providers here on stage have benefited from. I think that's the sort of thing that we need to do as an industry as we're looking forward to get more folks involved in the workforce pipeline. Can you talk about the beginning of that program and how it really spread throughout the country?
Sure, absolutely. So I have some colleagues at PHCA and NCAL that really do hone in on this program. They're nurses themselves. It has been a tremendously popular program and really has engaged a number of individuals to get into the long-term care field. So we have a TNA 8-hour training program and a 16-hour training program. To date, we've had over 350,000 individuals that have registered for that program. So again, it's been widely popular. We are very focused right now. Obviously, as the pandemic continues here, and there's going to clearly be long-lasting, effects and impacts for our industry. We're really focused on continuing the public health emergency as long as we possibly can. Because this is one of the programs that has come out of it and has certainly been extremely, valuable. So that is something that we are advocating at the national level for. We've heard some rumors as well that it could be ending the public health emergency the spring time frame. But again, we've really done a lot of outreach with CMS in particular on this TNA program, the importance of it, continuing it, as long as we possibly can, and again, how beneficial it has been.
As it relates to the work or the public health emergency, are there other waivers out there related to workforce that providers, whether they're in the room today or watching at home, should be concerned about that health emergency being pulled back could take with it?
One area I can tell you in particular that we've been focused in is the 3-day stay waiver. That is something that's really, I know, been a lifeline for a number of individuals. Several, I can say, at least on the beneficiary front, have kind of fallen into that trap of that 3-day stay requirement if they're not deemed an inpatient. They don't even realize that they're on observation. So that's something I know that certainly has helped, as well, hospitals clear their beds, get them into our skilled nursing facilities so we can provide care for them there. That is one waiver of many that we're closely following. There's also some Medicaid waivers as well that have a huge impact as well. But I can tell you the 3-day stay is one that we're really honed in on too.
Thanks, Dana. And Jeffrey, to go back to you, and then I'm going to open it up to the rest of the panel, and we'll bring everybody in on the discussion. So again, we're talking a lot about the ecosystem and getting different departments involved, getting different parts of government involved. Thinking back to your days in hospital administration, and again, looking at other industries, what are the success stories that you've seen that long-term care should say today, we could do this here in Pennsylvania?
Sure. Well, I think it really is creating that ecosystem. So, the first thing I would suggest is, as a hospital administrator, when my CEO came to me and said, we've got a nursing challenge or I've got a workforce challenge, we formed a relationship with our local university where it was a learning collaboratory where we actually developed the programs together. That's the first and foremost thing that you absolutely have an opportunity to do today. And I would argue that if you do something like that, you can find ways with the Workforce Board, IUs, and others to find some aspect of funding if it's done in a public-private partnership type of manner. The other thing that I think we've got to think about is, and I've shared this, Zach, with your team before, is that we've got to reach the kids also where they're at. So for some students, gaming is a way to reach them. And I know it sounds fun. Some people look at me and say, well, here we go. But the reality of it is that if we can reach them and help them understand in a video game what it's like to serve in long-term care, we may reach a child that is never going to be reachable through another way, because you know what? They're all gaming, and gaming is equitable. People game. So we've got to be thinking about VR and AR as another way to help them understand that you can serve in long-term care, i.e. a great way with colleges and universities again, because you've got how many that have these types of things. The other thing that I think you have to think about is this ecosystem at all levels of the state. There's how many different workforce boards. So, each workforce board is working on various different clusters. And I know there's some here, I see them in the back. The reality of it is they're all focused on these clusters, but how do we make sure, to Eugene's point, that we're bringing that together? So when you hear healthcare, we all know that generally means they're focusing on acute care. We know that. So how do we get them to make sure that as across the whole board, they're also thinking about the continuum? And so that's what I would continue to push is we've got to get them to be thinking about that, and then get those folks in an ecosystem manner with the college presidents, the university presidents, to join with you, to go to the governor, go to the departments and say, you've got to fund this. This is innovative. I think the reality of it is that we're not pulling our resources together from a lobbying and advocacy perspective on this issue enough to try and really make the meaningful change happen.
Thanks, Jeffrey.
One thing to throw out, because I think it's been touched on a little bit, and this is now certainly outside the audit perspective, but with now two kids in college. Now, I also think back to when I was in that K through 12 area too, which I think is a critical time you have to reach people. And that was, obviously this would be somewhat different now than, or at least my guess would be somewhat different now, particularly on the space program. But when I was in, particularly elementary school, there would have been 4 things: police officer, firefighter, astronaut, military. Assuming, who didn't want to pitch Game 7 of the World Series. But if you were sort of remove the one that like is genetically impossible, although you don't realize that when you're sort of, 7 or 8, those were the 4. The thing that is important to realize with that, as I sort of think about that, when I was in those shoes, and to me it was sort of astronaut because that was the closest I could get to be Luke Skywalker, it wasn't about the pay. I mean, nobody ever said, I want to be a police officer or a firefighter because that's the way to take out the Amazon CEO. It was, so I think there's a side of it. It could be a cool job, but I also think there's some meaning that goes to that. There's a higher purpose to that. Anyone that, regardless of what your faith you're in, if someone wants to become a minister or a priest, or, and myself being Catholic, when you think about somebody that wants to be a nun or a Christian brother that taught us in high school, nobody ever says, I'm going into that field because I'm going to be loaded when I do that. Now, there's some that that's not going to appeal to anyone. But the point is, this is the growing field where you can actually find meaning and purpose. Grow. I'm not saying those other professions don't have meaning, but this is the one that's actually growing. So I think that's how you get young people sort of thinking about this at a much earlier age. And on the gaming side of it, without knowing, I'm sure that's correct. Because regardless of what any of us think, you got to meet these kids where they are. Where are they right now? It's Instagram, it's gaming. God help us all, TikTok. I don't have the answer of what the video should look like. But and you probably don't want my recommendations on that. But that's where they're getting in their information. Reading the local newspaper. My kids are now in college. They may have New York Times or something else on their phone. They will have never, by the time they graduated college, they will have never read their local newspaper. And they are in a big majority on it. They will have never read their local newspaper. And I would be willing to bet, other than sporting events where my son and I might have been watching the NBA game, they will have never watched broadcast television news. I'm talking never.
Well, so let's stay on education, because I think that is really important, and getting to the younger Pennsylvanians, getting into the middle schools and the high schools. Stephen Meredith, what have you done? What are you doing? Or how are you trying to break into that world to recruit new workers?
Well, I think as I've listened to the panelists today, one of the challenges we have is we're trying to address a crisis, both, I compartmentalize it both strategically and tactically. I mean, we need the strategy of involving our youth and getting organizations working together. Those are long-term strategies that can have a positive impact. And we do things like we're involved with a group called Challenge program where we reward students in high school for achieving and doing well and improving in high school. We involve residents in coming to those awards and do that in, I think, 10 different high schools in our area. But we also still we can't only address the long-term strategic solutions and ignore the tactical immediate needs. And that's what the TNA was something that was done to address an immediate need. And I think for all the providers, I doubt you're any different than our facilities. What What we're talking about on a daily basis is not the strategy, but it's I have a hospital that needs to send me 3 people this week, and I don't have enough staff to take them. So we have to address those immediate needs while not forgetting the strategic. And that's really what makes this crisis so challenging and why we need to bring this many people together, because we have to address both of them.
Meredith, on your end.
Yeah, we had a great meeting the other day with Milton Hershey School, and those of you that may be familiar with them, we're lucky that we're headquartered right in Hershey, and they put their students on specific career tracks. So we were speaking with them not only about the healthcare track, but also the dining track and the vocational maintenance track. We have students from VOTEC schools that are coming in and being a part of our capital projects team. And, you spoke about going into a facility when you were younger. I think the majority of people who have ended up in this industry either have a family member who's in the industry that they got exposed to, or they literally just fell into it. I don't think you have it in between. Nobody aspires to be a nursing home administrator growing up. And we have a chronic disease within our industry, which is we are not sexy. And my goal is always to try to infuse, some of that energy and some of that meaning that we do experience as, caregivers and leaders within this industry as a younger person into other younger people. And again, bringing people on site is a great long-term strategy. We've interfaced with Penn State medical students who soon learn, okay, if I'm anything other than a pediatrician, I'm going to interface with Medicare in my practice. And when we bring them on site for several hours, I put them through a fitness class with our residents. I bring them to meet some of the other leaders within our campuses. I'll leave with a handful of them wanting to volunteer, because they see that there is meaning and there is purpose. And when we met with Milton Hershey School, they talked about, it was one of their career counselors who talked about how they help their students choose a career path. And they talked about not pay first. They talked about 8 different aspects of a company. And it started with health and wellness of that employee. And, I think part of health and wellness is seeing a path for growth. And we've worked internally to build our own career paths for each one of our positions, from caregiver through dietary through nursing. But I think, to Steve's point, we do need governmental help in terms of getting over some of the barriers that are created by our regulation, where you reach a certain level of barrier that people aren't willing to jump. So when you look at a CNA certification, it takes someone out of work for several weeks, so they're losing income, and then they have the cost to pay for that CNA. And even though employers have started to pay for that and say, if you come work for us afterwards, we'll pay for your certification, they're losing the time worked. They need childcare or they need support during that time. They need transportation to get there. And yet the TNA was such a good example of how can we provide that type of education in a more flexible way that this, not just the economy and this younger generation that wants, some of this gamification, but they also want the flexibility. You look at Uber and you look at the gig economy. And we're starting to get some scheduling softwares and some things that allow us to have people pick their own schedules. And we're moving more to that PRN position because we see that that's the need. But if we're not getting rid of some of the regulatory burden that still requires that 9 to 5 and still requires some of those barriers, again, at least in personal care assisted living, we train on site for our base caregiver role. And the state has allowed us to overcome some of those barriers, but we still have barriers of education that are in place. Someone needs a GED or a high school diploma. When I have someone who's come here from Africa and they can't prove that they have the equivalent, even though they were a high school principal where they came from, I can't employ them. So, I think some of the barriers that our government has created for us could be removed while still getting at the why for that regulation. It doesn't need to be degrading the level and the educational, requirement, but it needs to be done in a different way.
Yeah, and I think on that point, we're going to transition to the third round, but I don't want to lose the point, and that is, Meredith, I think what you're getting at is what we've heard today. It's not about making things easier. It's about providing accessibility.
And flexibility.
And flexibility to allow more and more Pennsylvanians to enter into that pipeline, which is going to be so critical. I want to thank our panelists for joining us today. And thank you for all your insight. Thank you for your support. And thank you for helping to tackle this crisis. We're going to go to round 3 now. And that's really where you at your tables are going to get to work. Before we do that, we do have a round 3 sponsor, and that's FarmScript. And Guy Carpenter, I want to ask you to come up and just say a few words before we dive into our work on round 3.
Thanks, Zach. Good afternoon, everybody. Hope you're all doing well. Do I really need to mention how challenging it is to manage a healthcare facility nowadays? I look at the audience and recognize that you all experience those challenges on a daily basis, from the resident's bedside to the boardroom. You're faced with doing well with less and doing it better. My name is Guy Carpenter. I'm with FarmScript. We are the 3rd largest pharmacy provider in the country. We partner with our long-term care and post-acute care facilities, providing them with medication and the resources and the technology solutions to help them meet those challenges. I'm proud to partner with PHCA to be a sponsor of this 3rd and very important 3rd round. Where do we start? So that discussion is going to allow you to exchange information amongst yourselves and collaborate and try and come up with a solution, a viable solution, or identify some ideas that will, as far as your workforce is concerned, coming up with a more reliable pipeline. So with that being said, I'm going to turn it over to Zach.
Thanks, Guy. And Guy said it really well, and this is round 3. This is where the work is really going to begin. What we're asking you to do is open the boxes on each of your tables, and you all have cards like the one I'm holding now. Knowing what you know now, or knowing what you knew before you got here today, we're asking you to do a few things, working with one another. And that's identifying ideas for us that we can use to help solve the workforce crisis. But we also want you to identify obstacles to those ideas, because we know that not every idea is going to be able to be implemented right away, and then ultimately solutions to those obstacles. And what we'll do at the end, as we said before, is put everything up on our big idea board. That's round 4. But we're going to give you the next 30 minutes to talk amongst yourselves, to identify those ideas, those obstacles, and ultimately those solutions. We'll be walking around and learning from you, and then we're looking forward to bigger discussion in a few minutes. But again, I just want to give a round of applause to our panelists. Thank you very much for being here today. Thank you very much. Appreciate it. If you guys want to join a table, Zane took your mic off, so now you can join a table.
Michael wanted me to make sure that
school, one of the programs in Montgomery County, Maryland is just that. It's a nursing program. So the county, the public school system is actually setting something like that up, which might be another opportunity county, here as well. Yeah.
All right, we're going to take a look at table number 6 over here and see how the conversation is going at table 6. Noelle Kowaleski with Carbondale Nursing Home. What's the conversation look like over here?
We're doing pretty good. We were just talking about how we utilized the TNA program so much during the pandemic. But we were talking about some of the challenges with the TNAs converting over to CNAs. We were talking about, potentially them getting frustrated because it's not really the easiest process as it should be with the system and scheduling their exams and their tests. So that's, one of our obstacles that we're talking about.
So I see a red card. So we got our first challenge over here at the table. We're going to work for a big idea on how to get to there, or a solution, and a blue card on how to resolve that. Is that where we're headed?
Right.
Perfect. All right. Thanks, guys. Keep working.
All right, we're going to stop in here at table 9 and see how the conversation is going. I'm with David Zilka of Paxton Ministries. David, how's the conversation going? What are you guys coming up with so far as big ideas go?
A lot of talk about education opportunities and some shadowing opportunities for high school students to be engaged. I think some discussion before was how to get people to have a passion for and feel maybe a calling towards this type of work. So really, how do we encourage that and find ways to fund that and provide doors into the facilities so they can start to get an idea of what it means to work in care.
Great. Thanks. We'll keep going, guys. We'll check in later.
All right, we're going to stop in here at table 5 and take a look at what's going on at this table. Representative Nelson, we had a great conversation today. I don't know if you have any initial feedback on the conversation from our panelists, but also how we're doing with our big ideas and solutions over here at table 5.
We're coming along with some big ideas here at table 5, I have to say. Trying to scale and focus on Pennsylvania level workforce development changes, just like a longer term commitment that the state may be able to make to providers. And I think we're about to get into some licensing issues that we can control here at the Keystone level.
Is there anything that stood out to you in the first 2 rounds that you heard from our panelists that are stuck with you and raised an alarm or concern that you might have and how we need to address things moving forward?
Yes, I think we were talking about the 3-day stay or the absence of the federal need for that. And I think the recognition of service-based professions and careers being enhanced through the educational process. I think it's an intangible that doesn't get captured right now when we made it a dollar and cent focus in career selection.
Perfect. Representative Nelson, thank you. Table 5, appreciate your time. We'll let you get back to work.
We're going to jump now to table 1. I have Susie Tack-Beardsley here with me from Quality Life Services. She is our new chair of our statewide workforce committee. Susie, how's the conversation going so far? What are you guys finding as far as big ideas, solutions, obstacles that we need to talk about?
Definitely plenty of obstacles. We've got some ideas on the table. One of the things that Kara brings is some insight from other states. Texas is doing something really interesting with a program for CNAs. And we talked about how do we take advantage of, how do we collectively pull our resources and be able to bring in refugees into the workforce, immigrants into the workforce, and not have each organization trying to figure that out on our own, because there's so many barriers and it's just overwhelming, and we're all putting out fires every day. So it's hard to really get your arms around things like housing and language barriers and things like that. We're not equipped to do that individually, but perhaps collectively we could.
Absolutely. And Kara, you, as Susie said, you bring a lot of perspective from the outside in. Anything from the panelists today that really kind of stuck with you about some of the things that we're facing here in Pennsylvania and ways that we can work together to address that?
Definitely. The TNA program is something that I think that ShiftMed could certainly partner with to help get some of those accredited into our CNA training programs to really help Pennsylvania with that.
Great. Well, keep working, guys. We'll check back with you later. Thanks so much.
Okay, lack of career ladders and poor staffing of so it covers can impact. Right now, it's a challenge. It's not possible right now. It can't happen tomorrow. It can't have an impact, and that's what we have to figure that out.
We've got a thoughtful conversation going on over here at table 4. I'm going to stop in and talk to Matt Morano with Transitions Healthcare real quick. And we're engaged in a deep conversation. So tell us about how things are going. What are you guys identifying as solutions? Or I don't see any red cards with a problem filled out. So that's, I guess, a good thing, but we have solutions. So tell me how things are going to the table so far.
They're going great. We talked about establishing a career path so that you can become a TNA all the way through an RN. And the way to do that is really to get medicine aids in the state. And we believe that that's an important step. There needs to be a way for somebody who has a high school education to come in, learn, become within 6 months, get a CMA so that they can make a livable wage, and then become either an LPN or an RN. And right now there's too big a gap between the CNA wage and the LPN wage, and we don't have those opportunities. What we're talking about right now is capping agency costs, because they're kind of fool's gold. Right now, you can go in and you can make that $33 an hour as an aide, but what happens after COVID-19? Then you're back to square one and you haven't created a career path. I've been in this business for 25 years. 20 years ago, I didn't worry about Sheetz and Walmart because I knew, A, I could bring in people at the same rate, but 5 years from now, they'd be making $33 an hour. And they wouldn't still be making $15 an hour if they were at Walmart or Sheetz. We've lost that in Pennsylvania. We've lost that career path, and we've allowed people to come in, and really, as a government contractor, I can't afford to pay what an agency can pay, but they're not regulated at all. If an agency nurse doesn't come into my facility, nobody loses sleep. If an aide doesn't show up at my facility, we're going to get cited, and somebody might not get good care. So we need to protect our seniors and stop the poaching of our staffs by people who have no regulatory agency on them, who don't care what happens to our residents, and quite frankly, who can afford to pay people more because that's all they're responsible for. They don't feed the residents. They don't put a roof over their heads. They are just providing care. So that's kind of why you got a spirited debate when you came to our table.
So we got more competition for the workforce as we see more service industries able to compete with what we're doing, and then some more regulations on what we're seeing with our partners in healthcare, with staffing agencies to offer some more oversight there. It sounds great. Sounds like we got things moving. We'll see.
And the SEIU also brought up a great point about bringing everybody to the table more, getting the providers and the workforce and the regulators together on a more global basis so that we can really highlight these issues and go forward.
Well, we hope today's a really good first start for that as we bring everybody to the room today and have these conversations. I'm looking forward to see the big ideas on green and the ideas or the challenges and obstacles that you guys have on red that we have to overcome to get to these solutions. So keep it up. Appreciate it. Thank you.
So we're taking a stop here at table 2, and I have Doran with me from the Pennsylvania Workforce Development Association. You guys are talking a lot about some of the comments that were made about immigration resettlement. How can we bring those people into the long-term care workforce? Tell me a little bit about what you guys are finding.
We had a good discussion about, cutting the red tape, looking beyond some of the regulations. And we thought it'd be a great idea to create some sort of standardized assessment that each potential candidate could take that would equate to the credentials needed to become a healthcare professional. Is that adequate enough? Have they demonstrated the skills necessary to come in and work in that field? The existing stakeholders, and I'm going to read Greg's comments, certified immigrants, fast tracking. There could be a position from students and possible unions that have already gone through that process. But our solution would be to actually create a standardized assessment to bring those folks into employment to alleviate the shortages.
Yeah, that sounds great. Thanks, guys. Keep discussing. I know you're still working on some of these and fleshing them out, so I'll let you get back to it. Thanks so much.
Thanks, Shane.
I don't know where our cards are. If I could just have everybody's attention real quick. if I could just have everybody's attention real quick, and I don't want to break up the discussion, but I want to give you an example of what we came up with, just a very easy example of the ideas, obstacles, and solutions. Higher wages is obviously a really good idea that we need to implement in long-term care, but the obstacle to that is a Medicaid shortfall and the fact that we're very reliant on Medicaid. We're so reliant on Medicaid, we couldn't afford tape for this. But so the obstacle is really our Medicaid shortfall, and then our solution is fully funding Medicaid in 2022. That would allow providers to pay higher wages for their workers. That's an example of what we're looking for today. All right, can I have everybody's attention, please? Can I have everybody's attention? Thank you. We heard a lot of just walking table to table, hearing that spirited discussion. That's exactly what we were looking for today. That's exactly what we were looking for. Before we go to our big idea board, which is very quickly filling up with ideas, obstacles, and solutions, I do want to recognize the sponsor of this final round, round 4, and that's Amy Story with Optum United Healthcare. Amy, why don't you come on up and get us started and say a few words, and thank you for your sponsorship.
Good afternoon. At Optum, we're committed to changing healthcare for good, and that's why we're proud to partner with Pennsylvania Healthcare Association for this afternoon's round 4 wrap-up, What's Next? In this final round, we'll hear all of the ideas and best practices shared during the discussion and organize them on the PHCA's Big Idea Board to help chart a clear path forward to ensure access to long-term care for all Pennsylvania seniors. Thank you.
Amy, and again, thank you to Optum for your sponsorship. So here's how we're going to do this. I'm going to turn it over to Eric. We've already identified some big ideas that you identified that we want to focus on. We're going to call out those ideas, and what we'd really like to do is hear from you, that you can speak in front of the group and say, here's why we identified this idea, here's the obstacle, and here's what we think is the solution. So Eric, what's our first big idea?
So we got a lot of good examples up here. I'm going to go first with the obvious. Improved turnover ratio is the big idea. We have a challenge of access to cost, location to daycare, and a solution to that is to subsidize or a tax credit to partner with a daycare center. Can we have a show of hands as to whose idea, challenge, and solution this was? Which table?
We are over here at table 2. I will go ahead and turn it over here so that they can explain exactly what they were thinking and what those next steps look like.
Thank you very much. Yeah, one of the biggest issues that we're seeing is the, we were talking so much about recruitment, but one of the biggest things we didn't start talking about until our group was actually the retention. And we were seeing so many people leave, so many people came into the industry because they love to be able to help people, but they didn't stay. And one of the reasons they weren't staying was because of daycare or, got overworked. So what we're thinking about as far as how do we resolve the daycare issue, and we were talking about different options and availabilities that, partnering up with a daycare center or tax breaks for, providers that offer daycare, and being able to give those who work whatever shift, if it's the early shift, to be able to get their kids, to be able to get the support they need, get the childcare that they need to be able to help them out. So
I think that's such a great point. Frankly, I'm surprised that it didn't come up during our panel discussion, because it is such an important factor in being able to keep our workforce, especially given the demographics of our workforce, as Meredith outlined during panel number 1. I would add that a state like Montana is really taking a forward-looking initiative at this. They're using American Rescue Plan money or ARP funds to pay for child tax credits and for daycare credits just for those working in long-term care. It's such a great idea, and again, it's something Pennsylvania could do today if they wanted to. Eric, what's our next big idea?
Here's another one that stands out. As we talk, need to educate on careers of compassion in our education space. The idea is education. What is long-term care? Educating on what long-term care is. The challenge is the lack of national or standard platforms, and the solution is healthcare academics, K through 12 setting. I'm looking for the table who came up with this idea, solution, and we're over here at table 7.
All right, table 7. Who wants to jump in and share some of the background on this particular idea?
So this was to piggyback off the idea of, how do we, first of all, how do we create an awareness? And it's just not a sexy industry. So we were thinking we need to make an awareness, describe and define what is long-term care. And then one of the obstacles that we uncovered is that there's this lack of a national standard or solution to create these education tracks. That was that's why we don't have them. And then the idea is then to create academies. So we have VOTEX, why not have healthcare academies throughout the school system, especially the public school system. So simplified.
That's such a great point. And we talk all the time about the focus on STEM. And Eric always has to remind me what STEM stands for, but it's not healthcare and it's not long-term care. I still don't know today, by the way, what it stands for. So
STEAM, if you're throwing arts in there.
So what we need to do is work with our national partners, Dana. Maybe that's something that ACA and PHCA and other state affiliates can work on to develop not just a state standard, but a national standard for education. I think that's such a great idea. Eric, the next big idea.
I'm seeing a lot of the education theme. So we have the big idea, encourage collaboration between Department of Health and Department of Ed and providers. The obstacle or challenge is uncoordinated regulations, and the solution is align programs to have realistic expectations. Do we know which table? I'm looking. Okay, we're looking over at table 6.
All right, we're going to stop right here. Here you go. Stephanie, jump in.
So the issue that we were discussing was the TNA was a great solution, a quick solution to bring people into the workforce. But the difficulty right now are the TNAs that are out there trying to convert over to CNAs. And although there were, I think the number was 350,000 TNAs that came into the workforce, how many of those are going to stick around and be there, because it's very difficult for them to convert over to CNA. I work for Dauphin County Technical School in adult and continuing education, and we have a CNA program. And I am finding that the TNAs are having a difficult time coming in, sticking out the number of hours, going from an 8-hour online course to 120-hour plus with skills that they may have learned that are different from the skills that they currently do in their particular facilities that are very much regulated by the Department of Education. So I think it was, I don't know if it was the Department of Health or what the department was that created the TNA, but the CNA is controlled by a Department of Education. So if those two departments could get together and be a little bit more consistent with how we can keep those people in the workforce without discouraging them and having them leave the workforce.
And again, another great point, and I think we heard that over and over and over again today from our panel, that there needs to be fusion of different departments, different government entities work together and communicating so that they can push policy that's really going to work for long-term care, for providers and for workers, and ultimately for the residents. Eric, next big idea.
I'm going to start with the challenge this time. The obstacle is ageism. The big idea is Pixar movie and awareness, but the solution for ageism is change the senior care stigma.
So we're going to come right back over here to table 7.
I guess I've become the spokesperson for table 7. So, you know, I can't remember who said it on the panel, but I was like, a Pixar movie. And I know we talked about Up at our table. We were talking about the movie Up. But talk about a way to get an international awareness of what it's like in a skilled nursing facility or that continuum of care. So what happens when grandpa or grandma or mom or dad goes into the hospital, and then what's the next step? And you just kind of follow this family. And then the other point was to, so the obstacle is ageism. So how do we get people to be aware of what that is? And then changing the senior care stigma. So one of the reasons we talked about this is because maybe it's an American culture thing, or, you know, we just did change that. And so we were thinking, what about a Pixar movie?
Two points on that. First, again, as the father of 2 young girls, I know every word to the movie Up by now, after watching it about 1 million times in the last 3 months. And second, you know, when you think about popular culture, at least for me, the only exposure I got to long-term care through TV shows or movies was for those who watched The Sopranos. Tony Soprano, spent 2 years, the first 2 seasons of that show, trying to keep his mother out of a nursing home and assisted living. And I remember emerging from that show and there really being that stigma attached to long-term care. So maybe putting it in a different light, especially in a Pixar movie or a movie for kids, could really yield a different result. Eric. He tried to kill his mother. Kelly, we're doing our Sopranos retrospective next week. Yeah. Eric.
We're seeing a lot of themes on alternative compensation or childcare again. So I'll go with this one up here. Alternative compensation is the idea. The challenge is affordable housing, childcare, and transportation. So we got quite a few challenges. And then the solutions of providing housing, meals, childcare for staff on site. Anybody want to jump in on that one? Are we over here? Table number 9. I'll jump in.
So this idea actually kind of came from me because we do some things like this. So I represent a small SSI personal care home here in Harrisburg. It was founded many years ago with the purpose of serving individuals in need in the community. So originally it was all volunteers. There were no paid positions. As time and regulations grew, it moved into needing paid staff. But the model from the very beginning was to have staff who live in the building. And part of their compensation remains living in the building at no cost and being able to eat in dining services and do those things as well. It checks off a lot of those affordable housing and transportation needs. For a period of time in our history, we don't currently have one, but there was a child care on site for the families that lived in the building. I also shared, I'm sure there's probably some research out there at the benefit of having families living in buildings with especially in senior communities. I know right now we have a single mother who has 2 teenage daughters who live in the building with us. So they're coming and going to school every day. The residents all know her kids by name. You know, they participate in community events. It really does create a very different environment. The benefit, you have, you know, people constantly there. So somebody calls off, you just say, sure, I'll go downstairs until you can get somebody to come in and cover for that call off, or I'll stay a little later tonight knowing that I don't have to drive home and fight traffic. So there's a lot of benefits to having that. Certainly a lot of challenges too, but creates a wonderful environment for your residents and also helps with staffing.
Thank you. We'll jump back to the board. We got another, this one's gonna be different. We're just gonna throw a challenge out there because we don't have the solution or idea to go with it. I'm sure there's lots of challenges that we need to overcome. So the first challenge is no more 2-step in PA. Looking for the table that came up with the challenge of no more 2-step in PA. We're down table 1.
Head over to table 1. Here you go. There still seems to be a lot of confusion. We were all, I think most of us were granted a temporary waiver when the pandemic first struck. And there seems to be some confusion there, even at our own table, with whether that can be a permanent waiver or not. It really, if the 2-step ends up coming back when the emergency declaration ends, it just really slows down the hiring process. And this is a time when we can't afford that process to be slow. So just want to make sure that that's gone for good. Oh, I'm sorry, the 2-step man too, the TB test. Oh, I guess for those of you that don't know, that was something that we always had to do. I'm not a clinician, so I might get it, I don't quite have it right, but you have to get 1 step, you have to get, it's something injected under the skin, and then it gets read a few days later, and then you had to get it done again a few days after that and get it read before you could start employment. 10 days, thank you, Aaron. Okay, and that was under the 2-step, took 10 days. Right.
So with the 2-step, the way it works, you get injected. 48 to 72 hours later, you have it read. A week after it's read, you have to have another injection and have that step read 24 or 48 to 72 hours after that. So a minimum of 10 days that the person follows the process correctly. In that 10 days, they're going to find another job. I mean, I want to start working tomorrow. Why do I have to wait 10 days for this 2-step? So if we can get away with the 2-step and just do 1 step, that'd be much better. And chest X-ray does not work. That's not a good. That's not an option for not doing the 2-step. So it is right. It's one of the few states that still does.
And thank you, Aaron. I want to just open it up to the room. Are are there ideas that we've put up on this board or ideas that you discussed that you think we should know or you want everybody in this room to hear? And we're going to end at this point, but I do want to open it up to the group. Is there something that we have said or highlighted yet that you think is important that we should be focusing on?
I think one thing we missed from our table was thinking about the TNA, the majority of the had experience with them, have had successful experiences with that program, and are still utilizing it. Another area that has completely, I think we're not talking about it, is the LPN side of it. They have completely disappeared. You know, we've always struggled with RNs, but let's face it, typically in a SNF, you don't staff your entire building with RNs. You staff the majority of your building with aides and a large percentage with LPNs who are the bedside nurse. One of the struggles we know is that the LPN courses are not at all flexible. There is absolutely no flexibility. So when you want to move an aide, we're all willing now to start providing more reimbursement, tuition. How does an aide who is a single mom who has perfect opportunity, we're saying to her, we will pay you to go be an LPN. How does she do it? How does he or she do it? When it's an 18-month program and it's full-time. So again, I think that ties into the TNA piece. We need faster pathways.
Point, and Matt, you want to add to that? Matt, I know you don't need a microphone, but we're gonna bring one over anyway for you.
In Pennsylvania, and I've been doing this for 25 years. I started in Maryland, and when I came over to Pennsylvania, been here for 10 years now, love the state, I was amazed at how fragmented the licensure was. They didn't talk about aides, charge nurses, medicine aides, RNs. Everybody was an aide, and you're an aide for life. Everybody was an LPN, and they were sometimes represented differently than RNs. What I'd like to see is certified medicine aides be introduced into the workforce in nursing facilities in Pennsylvania. I've kind of given up on the short term on the LPNs. They got to go through school. It's going to be 2 years before we get any more of those. In Maryland, there's a career path. I never worried about finding staff because I wasn't competing against the local grocery store or the local gas station. They weren't Sheetz in Walmart back then. They didn't have that much power, but I could usually pay more than that. If I couldn't, what I would tell the staff that was coming in, if they had the right heart, is that you can go work at the gas station. 5 years from now, what will you be? You'll be a gas station attendant. You can come to me. We'll work as a CNA, then a medicine aide. You'll make a livable wage so you can go become an LPN or an RN. And quite frankly, now the RN schools are so expedited that most of them are passing the LPN, they're passing the LPN step. And so what we have are aides and RNs, and that gap is way too big. And the RNs don't want to pass med cards. And the LPNs, some of them don't want to pass med cards, or quite frankly, because of our aging workforce, they can't. So we use their experience and their brilliance, but they don't exist anymore. So PA needs to have medicine aides in nursing homes. It's worked in, yeah. I can tell you this, in Maryland, the regulators would go right to the medicine aides, not because they were trying to trick them up, because they knew they were the best at passing medications. They took a lot of pride in it. I had 0 med errors with the medicine aides. Sometimes I was worried if they went to the LPNs, because that's not all they did. They did a lot of other stuff as well. So if we had that in Pennsylvania, it would definitely solve a lot of the issues with the LPNs. Thanks, Matt.
Are there any other ideas that you want to highlight today for the group? I don't want to miss anything. Yeah, go ahead. Hold on, Kelly. There you go.
Kind of similar to that, we talked about a proficiency. Like if you can prove proficiency at something, so if you're a refugee and you can't produce your high school diploma, there should be some sort of a proficiency test or some way to prove proficiency. Or if you want to be an executive director in assisted living and personal care and you don't have a 4-year degree, if you can prove you've been, I'd rather have somebody who's been in the community, in the setting for all these years, and work their way up through the ranks rather than somebody that had a 4-year degree. So kind of across the board, if you've proven you can be good at passing meds, you know, a certified med class is a riff on that. So I just thought that was valuable.
Thanks, Kelly. So here's what we want to do. We said there were 4 rounds today. There's actually a 5th round, and that's our cocktail reception. So that even got applause. Wow. I knew that would get that sort of reception. So what I want to do first, before we wrap up, is I want to acknowledge that we have 2 sponsors for our cocktail reception, both Snap Nurse and Wagman Construction. And I know Amy Young is here from Wagman Construction. Amy, do you mind saying a few words for us before we head over to the cocktail reception?
Good afternoon. I am Amy Young. I'm the Director of Business Development with Wagman Construction. And Wagman is a 4th generation family-owned construction firm. We're headquartered in York. We serve markets in Pennsylvania, Maryland, Northern Virginia, and Delaware. We can help you with your pre-construction, construction management, design build, development consulting services. We offer all of those. We can do the continuum of ground up new construction, complex renovations, smaller renovations, work through our special projects group. We're happy to be here today and to be sponsoring the reception. And I just want to say personally, I'm grateful to be here today. I am a licensed nursing home administrator by background, a former executive director, and I am still very passionate about all of these challenges. I started in the industry in 1994. This list has only grown, and workforce has been a challenge since the very beginning when I joined the industry, and I'm grateful to be part of these conversations today. So thank you.
Thanks, Amy. And I also wanted to ask Callie Hoynes from Snap Nurse to say a few words. Callie, thank you very much for being here.
Thank you for having us. It's great to be here. This is really our first time coming to a PHCA event, so we appreciate the welcome, and it's definitely been an eye-opening experience for us. So with my colleague Jenny Barber, again from Atlanta, Georgia. So Snap Nurse is actually the service and delivery arm of our parent company, Snap MedTech, and Snap MedTech was founded in 2017 to really help resolve gaps in scheduling. And since the pandemic, our mission has evolved a little bit. It's really become to help build a sustainable workforce and help improve employee and employer relationships. And so when we talk about gaps in scheduling, we talk about, an Uber-like gig economy. We have a few service lines that I think, are really interesting and have been fruitful in the conversations today. So again, thank you for having us, and we look forward to being a part of the solution.
Thank you. Thank you very much. And again, I want to thank everyone for taking the time to be here today for what I hope you found to be a very rewarding discussion. And I know from the PHCA standpoint, we've now got a lot of ideas, a lot of issues, a lot of obstacles, but also I think what's most important are a lot of solutions to those ideas and to those obstacles. My sense is that today is the beginning of the conversation. It's not the end of the conversation. A couple things that we're doing on our end. You've got cards at each table in which we're announcing a brand new website for prospective Pennsylvania long-term care employees as well as providers. I believe that's pennsylvania.carefortheaging.org, which officially is going online today, but we're really going to build over the next few weeks and months to again connect providers to workers and to provide those workforce solutions. In addition to that, PHCA is actively recruiting a director of workforce partnerships. We're one of the first state affiliates, if not the first state affiliate in the country to do this, to dedicate a position entirely to the workforce crisis. And obviously we think it's that important. What I would say to everyone today is follow us on social media, whether it's Twitter, LinkedIn, or Facebook. We're hoping to put out a quarterly newsletter on all things workforce that will go to this group and others in our membership, just where we're talking about how we're addressing some of these ideas. And we'll do that every day, and you'll see that on social media. Again, from the PHCA perspective, I think just in the last 2 hours, we've really built a terrific foundation on where we can go from here and solving this issue. So thank you. Give yourselves a round of applause. Thank you. Thank you. And I would ask you to join us right outside for our cocktail reception. Thanks, everyone.